Okay, so thank you, Doug, for that great introduction, by the way. Um, as Doug mentioned, I'm Dr. Carole Lunny, and I currently work for the Knowledge Translation Program. I'm also affiliated with the Cochrane Hypertension Group at the University of British Columbia, which is the Method Speaker Series, which you're hearing today. And please tweet me or X me at Carole_Lunny and use the hashtag NMA. So we actually did receive funding from the CIHR, which is the Canadian Institute for Health Research, and that went from 2021 and to the end of 2023, coming up very soon, actually. And we have no conflicts of interest to declare. I also wish to acknowledge the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations, on which the research team, or actually me in particular, operates. But we also want to acknowledge other nations across Canada, where the other team members reside as well. So, first of all, our steering group is made up of myself, Ian White, Julian Higgins, Sophia Diaz, Brian Hutton, R.G. Veroniki, Jim Wright, Penny Whiting, and Andrea Trico. We also have a slew of stakeholders from all across the world, international stakeholders, and they've been consulted in a survey, as well as we're going to be asking them to help us disseminate our results. We also have occasionally worked with master's students and other students to help us with various phases of this, and with developing our website, which is underway right now. So we would like to thank, and we also would like to acknowledge and thank all of the people that have helped us along the way in our Delphi surveys or our surveys or any other process that we've gone through. So first of all, why is it important to assess network meta-analyses or NMAs for biases? So without a risk of bias tool for NMA, knowledge users or users of NMAs will not be able to tell whether a single NMA is at low risk of bias. So multiple NMAs are published on the same topic all the time, and choosing from them is actually impossible without a risk of bias tool. So this is an example of a study on the right where the authors found 28 NMAs on treatment for rheumatoid arthritis, all with different results, which poses an impossible task to any even a methodologist, let alone like a researcher or like a practitioner, clinician, or policymaker. So if an NMA is at risk of bias and inappropriate methods are used, the validity of findings can be compromised, which can impact, later down the line on patient treatment and care. So then our objectives were to develop a tool to assess the risk of bias in the results and conclusions of a network meta-analysis. We also wanted to develop guidance and training to accompany the tool. So we have four main methods that we use to develop the tool. They were first a methodological review to identify items related to biases in network meta-analysis. Secondly, a survey to ask decision makers about the tool structure and what type of tool they would actually be using or use in their practice and policy making. And we also did a Delphi survey with NMA experts to kind of ask them which items we should include in the tool, although the steering committee make the ultimate decisions about which items to include and which not to include. And then we are also currently undergoing pilot testing for tool usability, efficiency, and comprehension. So we actually have the methodological review items, which is being considered. It probably will be published in systematic reviews imminently, hopefully. It has been a year in process, and we have also published our the results of our Delphi survey and knowledge user survey in BMJ Evidence-Based Medicine Journal. And the title of that was Knowledge User Survey and Delphi Process to Inform development of a new risk of bias tool to assess systematic reviews with network meta-analysis. So what do authors mean when they say they are assessing the quality of the study? So this can mean a lot of things. So first of all, do they mean they assess the quality of reporting? Do they mean how well the study was actually conducted according to guidance, or whether the study or the review was at risk of bias? So here, reporting quality is about how well described in the manuscript the methods or findings are. And then methodological quality is kind of defined as how well the research was conducted according to guidance specific to that study design. In our case, it would be reviews. And then risk of bias about whether the limitations in a study can potentially bias the methods and findings. So here our risk of bias tool seeks to measure bias only. So other tools frequently mix up issues related to imprecision, quality of reporting, or quality of conduct. So our team here just decided that it was just going to be a risk of bias tool only to assess bias, or what we call systemic error. So then what do we mean by systemic error? So bias refers to systemic error, so meaning that multiple replications of the same study or the same review would reach the wrong answer on average. So bias here, and also just to mention too that when there is bias, there may be an overestimation or underestimation of the effect of a drug or intervention in a meta-analysis. So here, bias should not be confused with imprecision, because imprecision refers to random error, meaning that multiple replications of the same study will produce different effectiveness because of sampling variation. So this random error is that each time, so for example, in a trial, each time a trial takes a sample and measures outcomes, they'll get natural variation from the true values in the whole population, so that the smaller the sample, the more variability and imprecision there are. In a meta-analysis, for example, with results of smaller studies with fewer events, they are less precise. And when they're less precise, it's generally reflected in wide confidence intervals around the treatment effect. So bias is also not the same as quality of conduct. So even a well-conducted review can be at risk of bias. For example, if a review searched 3 databases, which is according to guidance, but they didn't, search the correct databases for the studies and the conditions that they're looking for, they'll have missed relevant studies, which definitely introduces bias. So similarly, if not all methodological flaws are relevant to bias. So for example, failure to perform a sample size calculation or to obtain ethical approval are important markers of study quality, but they're unlikely to bias the results. And bias is also not the same as the quality of reporting or the comprehensiveness of reporting. So like it's like improving, but studies, rarely report everything that we want them to in the methods in great detail, and sometimes also in the findings. So a systematic review may have used rigorous methods, but if they're not described in the manuscript of the paper, then then that's not good for us when we're going to be assessing the paper later on. So finally, what type of tool have we developed? So this, I'm going to be talking about the type of tool we developed across several slides. So first of all, our tool is intended to supplement an assessment of the risk of bias in the underlying evidence review, and ideally that would be a systematic review. So, as systematic reviews with network meta-analysis contain many of the same steps as conducting just a general review with pairwise or traditional meta-analysis, assessors should start their risk of bias assessment using a tool like Robus, which was authored by Dr. Penny Whiting and colleagues, or another suitable and validated tool such as Amstar2. So both Robus and Amstar2 have gone through extensive validity testing, whereas other tools have not. So our tool also uses a domain-based structure, and it uses signaling statements. And our tool also is good for any type of network meta-analysis. We focused here on interventions. However, we do plan on actually extending it to other different types of NMAs, but it should work for, generally for all different types of NMAs. And it's not just for NMAs with RCTs, but it's also good for non-RCTs as well, NMAs with non-RCTs. Okay, and also just kind of wanted to take a moment here because we also wanted to assess both the bias in individual NMA results. So that's, remember, we're looking at one single NMA here, and also the author's conclusions on that NMA result. So, network meta-analysis of effect estimates from primary studies can result in over or underestimation of the effects of a specific intervention comparison. So, for example, Chiamani and colleagues conducted a network meta-epi study where they found that in the majority of 32 networks that they analyzed, small studies tended to exaggerate the true effect estimate of the intervention, possibly due to small study effects and publication bias. So this is why we want to first focus on results. And then bias also might be introduced when interpreting the NMA results when authors draw conclusions. So types of conclusions can include spin. So spin is like, for example, biased misrepresentation of the evidence, perhaps, to get published. Because as we all know, positive findings get published more often or have in the past. But spin could also mean like erroneous misinterpretations of the evidence as well. So ideally, potential biases identified in the results of the NMA might be addressed appropriately when drawing conclusions. So we ideally want, that to be like an unbiased conclusion as well. And a well-conducted review draws conclusions that are appropriate to the included evidence and therefore can also be free of bias when the primary studies themselves have high risk of bias. Okay. So I think I mentioned this, but I wanted to just kind of really take a moment to say that our tool is is designed to assess one single network within a systematic review network meta-analysis. And it's not applied to the study level, and it's also not applied at the outcome level. So different outcomes will often but not always correspond to different outcomes addressed in the systematic review. So there'll be like several different network geometries for each of the outcomes, and multiple NMs can also be reported for one outcome. So for example, multiple networks can be reported in the manuscript for the same outcome, based on different scales used, so different depression scales, for example, different time points from those from those trials, and also due to sensitivity analysis to make sure that the findings of the network meta-analysis are robust. So it's important that when doing an assessment using our ROB NMA tool, that the assessor actually tells us which network geometry they're using in their assessment and what outcome and where it is exactly in that manuscript, so that going back, a second assessor could know exactly what they're looking at. So assess specific network result is taken because biases in studies could act unequally and both across both the study level, but also the outcome level, and now the single NMA level. And so working on an assessment of that network, make sure that we're focusing on that specific thing and assessing bias in relation to that exactly. So, okay. And then, there's so many tools out there. Like it's so confusing, not just for, researchers, but everybody else out there. So I wanted to just let you know where our tool fits in with other tools. So in our figure here, you'll see on the top left, it says review/NMA authors, and then on the right, it says review/NMA assessors. So the figure illustrates a range of tools that could be broadly fit into these two categories. So those that typically are used by people that are actually doing or developing, doing the NMA themselves, so authors of those NMAs, and then tools that are used by people that are assessing only those NMAs. So we'll focus, I'll just talk right now on NMA authors and the tools that they would use. So they would use tools like, for example, the risk of bias tool, risk of bias 2 tool by Cochrane to assess, the primary study risks of bias. They may also use the Rob-Me tool or the Rob-Men tool for assessing missing evidence across those trials. And then, looking at bias and precision, indirectness, heterogeneity, and inconsistency, they'll use the cinema or the grade NMA tool, although there is the threshold method actually as well that could be used. And then when they're about to publish and they have their manuscript ready, they'll hopefully maybe beforehand, but they'll look at what they've reported and they will use the Prisma NMA tool to kind of highlight where everything is reported in the manuscript. And then for NMA users or assessors of NMAs, what's seen here on the right, they'll use first an appropriate tool like Robus or possibly AmStar2, which are, as I mentioned, validated. And then for the network meta-analysis part itself, they'll use our ROB NMA tool. Oops, sorry. So we have developed guidance, and it's called an elaboration and explanation guidance document. It contains, first of all, it contains like an overall talking about the structure of our tool, definitions of each of the terms that we use. Yeah, it gives like a broad overview of what we're doing. And then specifically, it goes through each item. It gives the background to each item. It talks about the possible mechanism of bias for each of the items. So why, we think that this might bias the results of an NMA, which I think is quite new. I don't think other tools have done this. We wanted to be very transparent. And then finally, the guidance document also lists like how to assess the items, and we go through, how to assess it based on each of those signaling statements, be it true, probably true, false, probably false, or not no information. So it's very clear, hopefully, to the assessors, how to assess each item. And then we are working on a website currently. It's nmabiastool.org. There's nothing for you to look at right now, but hopefully we'll have something by January. And there we'll have training and as well like training videos to go along with the tool. So this is a preliminary look at the structure of the tool. Here, there's 3 domains to the tool, which you see on the left here, namely interventions and network geometry, effect modifiers, and statistical synthesis. In total, there are 17 items across 3 domains. Domain 1 contains 4 signaling statements, domain 2 has 4 signaling statements as well, and domain 3 has 9 signaling statements. So the range of different responses to the signaling statements are true, probably true, false, probably false, and no information. So true and probably true are considered to be pretty much the same. They just express different levels of uncertainty in the response. Same for false and probably false. And then no information should be used really quite sparingly and only when it's pretty much impossible to make a judgment of yes or no. So we also encourage authors to present their rationale for why they chose the response and provide a direct quote from the actual NMA to support that judgment. As well, at the end of each domain, there is the domain level judgment. And the signaling statements then lead an assessor towards making this judgment, which can be actually low risk of bias, some concerns, or high risk of bias. So here we have some concerns, and this some concerns replaces, what is found in typically like other tools like Robus. And it replaces what would typically be an unclear concern. So that's we've chosen some concerns here. And then finally, so you have the final phase, which is to make an overall judgment, which is rated for the specific and a single NMA result and network, and then also separately for the conclusions related to that result. These are judged by the responses, no concerns, some concerns, or concerns. So here are the items in domain 1. But first I just want to give you just a brief introduction to the items in each of the domain, because I don't have time to go over all of the items themselves. But as I mentioned, I can actually, I don't know if I mentioned, but I'm going to be doing a longer workshop later on all of the items. And if your organization wants to, contact me and have like a customized presentation on the tool, I'm welcome to do that. So after I kind of present the overall domain and the items in the domain, I'll just go over like one or two examples of items in the domains just to give you an overview of the tool. In domain 1, then there's 4 items here. So first of all, there's 1.1, all interventions and their comparators included in the NMA are reasonable alternatives for the whole target population. No interventions were inappropriately excluded from the network. Item 1.3, interventions were appropriately grouped into nodes in the network. And then 1.4, all compared interventions were connected through a suitable chain of within study comparisons. So I just want to stop and note here that here we're concerned with the interventions included in the network. So not the included studies. We're looking at the interventions. So this is not a study level assessment, but an assessment here at the level of the included interventions for this domain. So further, these 4 items should be based on the single NMA result, and that would be in the results section of the manuscript and not in the method. So this is about results. So here's an example, item 1.2, and it is no interventions were inappropriately excluded from the network. So here to ensure transparency and completeness of reporting, NMA authors should make it clear when interventions are eligible for inclusion in the network meta-analysis and the rationale for this choice. It's important to examine the rationale for the exclusion of eligible interventions or primary studies from the network to determine whether the decisions are adequately justified. So exclusions may be reasonable, for example, if they arise from strong concerns about violating the assumptions of the NMA. Um, and this is actually really tricky to assess. So, for example, like, there could be all interventions, but some of them might, for example, not be used in practice in certain countries. So, it's really up to that assessor to really, first of all, have a clinician on hand if they're a researcher or a methodologist, and make sure, that all the interventions that might be eligible are indeed listed in the network meta-analysis, or have a very strong rationale for not being included. Um, and then finally, empirical research has shown that exclusion of an intervention, so either an active intervention or a comparator from a network, can have important impact on estimates of intervention effects, and therefore can bias results. So, a primary concern here is that interventions may be excluded based on their predicted or known effect on the results of the NMA. So, here it's purposeful exclusion, which is not good, obviously, in order to ensure that results agree with prior views about the relative effect of the intervention. So, here we're looking for, like true manipulation. And I just want to say too that on the left, we have kind of an extract of what our elaboration and explanation document looks like. I think I kind of talked about it a little bit, but we have the title of the item on the top, the background, what's the mechanism of bias, and then specific instructions for assessors on what to do, for example, if they want to answer true or probably true. Okay, so another example from this domain is item 1.3. Interventions were appropriately grouped into nodes in the network. So the grouping of interventions or specific implementations of that intervention into nodes is often required in a network meta-analysis. So this applies to groupings of any control interventions as well, included in the network, such as, placebos, no treatment, or usual care. So, for example, like, studies from 1980, if an NMA has studies from, all the way from 1980 to 2023, there may be very kind of definitions of standard of care from 1980, for example. So when interventions are grouped, it's important that they are sufficiently similar in their definitions, and then they're not expected to systematically differ in their relative treatment effects. So bias may arise for the target question if the intervention, the effect estimated by the combined interventions does not reflect the effect that would be observed if the target population had been used. So here's domain 2, and there's 4 items in domain 2, and their outcome definitions and time points were similar across direct comparisons in the network. Effect modifying participant characteristics were similar across direct comparisons in the network. Effect modifying study characteristics were similar across direct comparisons in the network. And then the final item is if false or probably false were answered for these first 3 items, then the analysis appropriately addressed the differences in effect modifiers across the network. So here, these are all very similar. They just have to, they're just asking assessors to explore effect modifiers in outcomes in their time points, participant characteristics. And then here in our example item is the study characteristics. So, and the key point is where they are across the comparisons, the direct comparisons in the network. And here we're looking at the comparison level. So effect modifying study characteristics can vary across studies by a particular comparison. So same like pairwise meta-analysis causing heterogeneity, but here between comparisons causing inconsistency in the network. So for example, design feature study characteristics like design features such as cluster randomization or run-in period. Study characteristics could also be something like study settings such as primary versus secondary care. And so if there's an imbalance in the distribution of effect modifiers between, say, the different types of direct comparisons, then there will be bias. So here's an example. If studies comparing intervention A with intervention B are mostly conducted in primary care and studies B versus C are mostly conducted in secondary care, then an indirect comparison of these results to estimate the intervention of effect A versus C will likely be biased for either of the settings if intervention effects tend to differ systematically between the settings. So this is due to the failure of transitivity and or consistency to hold across the sources of direct evidence. So the final item in this domain, I think you remember, asked whether, all of these items, if there were effect modifiers identified, if they were appropriately addressed in the analysis or the synthesis. So appropriate methods for dealing with, effect modifiers would be, exploring them through meta-regression, subgroup analysis, or using a mixed effects model for the NMA. So here's domain 3 and the synthesis domain. And so here in this domain, there's 9 items, and they are eligible studies were included in the analysis. And then all predefined analyses and only those analyses were reported or departures were explained. So biases in primary studies 3.3 were minimal or addressed statistics. 3.4, appropriate methods were used to handle multi-arm studies. 3.5, appropriate assumptions were made about homogeneity or heterogeneity of effects within comparisons. 3.6, there was no evidence of conflict between direct and indirect estimates of the same effect. And 3.7 moves on from 3.6. So if false or probably false was answered to 3.6, conflicting results between direct and indirect evidence were adequately addressed. And then 3.8, if a Bayesian analysis was performed, the choice of priors was appropriate. And then 3.9, sensitivity analyses demonstrated that findings were robust to the statistical model and estimation methods. So here, note in the synthesis domain, we don't have an item related to intervention rankings. So this is because bias in any of the items that are in this tool, all 17 items, is likely to lead to bias in other NMA summaries, such as intervention rankings. And so, for example, it would be SUCRA, but there's other ways of doing that as well in frequentist. So here's an example. So I've chosen item 3.7, which is about conflicting results between direct and indirect evidence were adequately addressed. So an NMA is not valid when the direct and indirect evidence are not in agreement. Conflict between this direct and indirect evidence implies that fundamental assumption of transitivity or consistency it doesn't hold in the NMA. So this conflict may lead to bias in network results. And then when direct and indirect evidence for a comparison don't agree, there's inconsistent information from that comparison. And then depending on which source of evidence is nearer to the truth for this comparison for the underlying research question addressed by the network, and on the relative amount of information each source, results for this comparison and other comparisons, may be biased. So after, all of these items were assessed, you would then, kind of merge this risk of bias in NMA assessment into another, appropriate tool that assesses the systematic review portion. So here we recommend, Robust to do that, because Robust is, really well-developed comprehensive tool, and it's domain-based and really focuses on biases in the systematic review. So here's what Robust looks like, just to give you a quick overview of Robust, because we want to talk about how to kind of merge Robust with RobMA. So there's 4 domains under consideration. study eligibility, identification and selection of studies, data collection and study appraisal, and synthesis and findings. So each domain contains singling questions that are answered using a yes, probably yes, no, probably no, and no information. And having answered the singling questions in Robust, you make a judgment that indicates at the domain level if you have concerns about the methods relating to each of the domains. And then the responses for at the domain level are low, high, or unclear concerns about the methods that are reported. And then here, I really wanted to make sure that you know that our ROB NMA encompasses the synthesis questions in Robust. So the synthesis domain is not used in Robust when merging it with a ROB NMA tool. And therefore, this domain is skipped when you're, assessing a systematic review with network meta-analysis. And you will use the ROB NMA's overall judgment to make conclusions about the systematic review with network meta-analysis. So again, so the overall, this is what kind of like you would do. So first of all, you would use, say, for example, the Robust tool. And you would actually insert or write down what your responses were to domains 1 to 3 with your judgments and the rationale. And then you would do the same for the ROB NMA tool. You would write down what your concerns are for the 3 domains. And then finally, and then you would do this like as well, just, for the ROB NMA, both at the results and the conclusions level. And then finally, like the overall judgment, to assess based on results and conclusions. So because, assessors might be interested in the results of the systematic review, you know what I mean? Like for maybe they're only looking at one particular outcome, for example, in their research or policy making. But they might, if they're using the results of the whole systematic review and that network meta-analysis, they might also be, looking at that specific conclusion from the authors about that NMA, single NMA result. So whichever, which one, assessors might be interested depends on the purpose of the bias assessment and whether they're using the results or conclusions, in their policy or practice or both, or their research, for example. So piloting. So here we are recruiting experts and authors of NMAs currently, like in the first phase of piloting, and then after we'll be recruiting kind of like everybody else in the second phase to pilot our tool. So pilot assessors will use our tool to assess an NMA of their choosing. We're saying that you choose the NMA because we really want people to be familiar with the clinical topic when they're doing their network assessment. And then we also ask them to complete a user survey, to determine, how easy the tool was to use, or, if kind of clarify, kind of how the tool, like, the elaboration document is written and clarify anything that seems confusing. We'll also ask assessors, piloters, to record their mean time it takes them to do an assessment using ROB NMA only. And then we're also going to ask them, about the items that they find difficult to answer, because then, if a lot of people find, for example, item 1.2 difficult to answer, then, obviously we still have some more work to do. If you're interested in piloting too, please just email me. My email's at the bottom of the slide there. So in conclusion, the ROB NMA tool assesses the potential risk of bias by identifying potential limitations in the way an NMA was conducted, including aspects of how the evidence was assembled that may lead to bias in the single NMA results or the author's conclusions of that result. So our tool contains 17 items organized into the 3 ends of interventions and network geometry, effective modifiers, and statistical synthesis. And we've developed specific guidance which explains the background, the mechanism of bias, and how to assess each item based on, the very particular responses, which will hopefully, uh, you know, eliminate any kind of discrepancies across assessors. And also, we've started piloting, and we welcome people that are interested in piloting the tool. So I thank you for your attention, and I welcome any questions.
Thank you very much, Carole. That was a great presentation. And I'll just remind people, we have a few questions in the chat already, but if people have other questions, please feel free to put them in the chat. The first question we have in the chat, was there an established methodology that you followed in creating this risk of bias tool?
Yes, thanks for that question. So there's a few papers. There's actually two papers out there. One is by Dr. Penny Whiting and her colleagues, and it's about how to actually develop a risk of bias tool. And so we followed that. And there's also some papers out there by Dr. David Moore as well. So we use that. And then for our methodological uh, results paper. There was two papers that we used. One was by Matt Page as well to do that. So we did use very established methods.
Thanks, Carole. And how long did it take you to get this far with development of the tool?
Yeah, so it's been a journey, I have to say. I think we started in 2021, so it's been quite a while now. It's like 3 years, coming on four, to get to the point that we have. We have, our steering committee. It's, like, the brightest people in NMA out there, and of course, it's going to be conflicts and people disagreeing. But I believe that the more brains in the room, the better, and the more debate, the better the tool will be. So, and that's why we're asking people to pilot as well, because we just, we want it to be accessible to everybody, and we want to use your feedback as much as possible.
Thanks, Carole. And we have another question in the chat. I hope in replication studies, fear of refuting the prior established results by perceived giant scholars in the field and non-publication bias of research in accepting the none or alternatives hypothesis, in effect, statistically not significant results, have less tendencies of publishing might be major reasons. How can the research platforms encourage such types of study findings to be published?
Are you asking about, reporting and how to improve reporting? Um, how do publishers, are you asking how publishers, could kind of, be gatekeepers to try and, reduce biases in studies? I mean, all of that is very tricky, and we are going to be targeting, journal editors, grant, funders, to try and make them aware of our tool, because then hopefully peer reviewers as well as, editors, um, will be able to, use our tool to be able to assess the studies that are out there. It's all just about dissemination, and knowledge translation, and how good a job we do about that. But, it's, also it's like we're all a community, and, if you also could help to, spread the word about this tool, that's word of mouth is the most effective, way to get methods out there and known to people. So yeah, your help in doing that would be greatly appreciated.
Thanks, Carole. And Belay, if we've misinterpreted your questions, please feel free just to add on in the chat if you want to clarify anything. And in the meantime, I'll just move on to the next question, which I think you covered a bit of this, Carole, during your presentation. But what are your future plans for the research? So maybe in terms of timelines for the website and for the piloting, and anything else you'd care to add?
Yeah. Yeah, thanks. So we haven't, one of the things I didn't mention is we haven't published this yet, and that's because we're kind of collating. We think we got like about 12 piloters so far to pilot our tool. And so we're going to be compiling that information and information from future piloters and incorporating that into the tool if, there's any uncertainty, if there's any kind of confusing parts, if, trying to make things clear, maybe refining some of the wording. Um, and so once we do that, we're hoping to have our, collaboration and tool submitted in January. We would like to ideally, submit it to multiple publications, multiple journals, so that it gets as wide of a coverage as possible and reaches as many people as possible. So we're working on that. And with regards to the network, so for our website, that will be we're working on that this fall, and again that'll be ready in January, so I'll send out a tweet, and then perhaps if you're interested as well, I could send it out to everybody who kind of signed up for this list. And then, what was the other part of it? I guess the other plan is piloting. So, as I said, right now we're kind of seeking NMA authors and experts in biases in NMAs or, methods in NMAs to pilot the tool and see what they think. And then we're going to kind of roll it out to the general research public or, policy public, grant maker public, journal editors, that type of thing to see how they think. And but we want to make sure we have like established training, before that, because we really want to, create videos and have really strong training so that, they are able to use our tool, to the maximum efficiency, with, getting bogged down in some of the, statistics or, methods in network meta-analysis. So yeah, so that piloting will be continuing, next year. Um, the other thing that we kind of want to do is we want to do like inter-rater reliability testing, to test, yeah, to do that type of testing, and just also have testing on our website as well, to see how good our website is.
You're going to have a very, very busy year ahead of you, it sounds like. The next question we've got is what's the biggest obstacle that you've encountered so far during the development of the tool?
Oh, I mean, like to be honest, getting people together, like meeting, like it's very challenging, with obviously the steering committee being as, as well known as busy as they are. Like it's, sometimes been a challenge, to get them in the same room all at the same time. Yeah,
I
that's
can
definitely
imagine.
been the biggest challenge so far. So.
We have another question in the chat. It's from Guillaume Grenet. Will concordance of evaluators on the network, on the same network meta-analysis be tested?
Yes, so we're doing that. So as I said, we had 12 people who've piloted so far. So we are doing inter-rater reliability testing. So seeing, if there's agreement or disagreement across two reviewers, and then kind of like seeing, if there's too much disagreement, obviously that's bad and there's something wrong with our explanations. So, we'll do that across like quite a few piloters, and then I'll bring this information back to the steering group, and then they'll make a decision about whether, to change the wording or to, kind of do some small refinements from there.
Any other questions for Carole? We can take a couple more minutes. If there are any more questions, please just put them in the chat. And Carole, we've already got some interest from people in potentially being involved in the piloting, and interest in having the information sent out to all the participants.
Yeah, so we don't, I mean, I've presented all the items to you, but really, we only want to be using it for piloting right now. We haven't published, and so, we don't want people using this because the items could be changed. We don't think they're going to be changed significantly, but the wording can be changed. So, ideally we don't want to get it out right now, but once we decide to publish, which I said will be like December, January, I will post a preprint of that so that, there won't be any delay.
Thanks, Carole. So I want to thank you very much for presenting today, for a great presentation.